Loss, Grief, and Mourning. Module 2, Nursing Assessment, Grief Responses, and Professional Presence. In this module, we focus on the nurse's role in assessing and supporting individuals experiencing grief. While grief is a normal response to loss, nurses must distinguish between adaptive grieving and signs of complicated grief that require intervention. Assessment begins with exploring the client's perception of the loss. Ask open-ended questions such as, "What does this loss mean to you?" and "How has this affected your daily life?" Assess emotional responses, coping patterns, spiritual beliefs, cultural practices, and support systems. Importantly, assess for complicated grief. Warning signs include persistent, intense yearning beyond expected time frames, worsening symptoms over months, inability to resume basic functioning, profound hopelessness, social withdrawal, and persistent guilt. Complicated grief may progress into major depressive disorder and carries an increased risk for suicide. Always assess directly for suicidal ideation when hopelessness or despair is expressed. Use validating statements such as, "This must be very painful," or "I can see how much this loss matters to you." Avoid minimizing statements like, "At least they are in a better place." The nurse's role is presence and validation, not reassurance or correction. Allow adaptive denial early in the process. Encourage expression of feelings. Support cultural rituals and memorial practices. Promote basic self-care, including nutrition, hydration, and sleep. Grieving individuals often neglect physical needs. Grief affects the entire family system. Encourage shared storytelling and open emotional expression. Assess for family conflict, complicated dynamics, or members at higher risk for depression or suicidal ideation. Families are part of the unit of care. Hospice care focuses on comfort during end of life, typically when life expectancy is 6 months or less. Palliative care focuses on symptom management and quality of life at any stage of serious illness. Understanding this distinction helps guide family decision-making. A client states, "It has been 8 months and I still cannot leave the house or return to work." What should the nurse assess next? The correct answer is evaluation for complicated grief and suicide risk. Functional impairment beyond expected cultural norms requires further assessment. We've discussed the clinical features of grief and the assessment process. But grief work is not just about identifying symptoms. It is about being present with suffering. Before we move forward, we need to examine the role of compassion in nursing care. In grief and loss care, compassion is not simply a feeling. It is the ability to sit with someone who is mourning and to remain present in the face of their pain. Compassion is less like an emotion and more like a human capacity that is developed and sustained through relationships. It grows through connection, presence, and shared humanity, especially when someone is navigating loss. It also needs to be shared and passed on. Even brief and genuine expressions of compassion can strengthen this capacity within ourselves and nurture healing in those who are grieving. However, truly hearing another person's grief can bring us into contact with our own experiences of loss, vulnerability, and unresolved pain. At times, we may feel the urge to turn away, not because we lack empathy, but because we are instinctively trying to protect ourselves. This is why self-reflection is essential in grief nursing. Nurses must be aware of their emotional responses, personal grief history, and internal conflicts that may surface while supporting someone in mourning. Compassion without self-awareness can lead to emotional exhaustion, avoidance, or over-identification with the patient's loss. Compassion paired with reflection allows us to remain steady, grounded, and therapeutically present. Grief care requires both clinical knowledge and emotional maturity. In this module, we explored nursing assessment, the grief response, including recognition of complicated grief and therapeutic presence. In Module 3, we will shift from understanding grief to actively supporting individuals through it, focusing more on therapeutic communication, interventions, and the nurse's role in promoting healthy mourning.